This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV. Hospitals are designed to house the sick and the injured, but in some cases, they can also be the source of healthcare-associated infections. Patients in a healthcare facility and even hospital personnel can acquire these nosocomial or hospital infections, with most affecting the urinary tract, bloodstream, lungs, and wounds.
Healthcare-associated infections are actually infections that the patient will get by getting or receiving health care from hospitals, yung chronic care facilities like dialysis unit. So anyone who's receiving health care who will get infection due to that, that's called healthcare-associated infections.
According to the World Health Organization, at any moment, roughly 1 in every 20 inpatients has an infection related to hospital care. In the Philippines, 500,000 patients get hospitalized associated infections yearly, with about 10% of the cases considered fatal. This type of infection may manifest after a couple of days of visiting a hospital. Although newborn babies, the elderly and those with weak immune systems and medical conditions may have increased risks.
Generally, it would be something that the patient will get after 48 hours of admission as a result of either treatment, diagnostic, or management.
The important thing is that you know what to do prior to and after your visit to the hospital, since this will greatly decrease your chances of you getting an infection. What are the most common hospital-associated infections? What are my chances of getting an infection in the hospital? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Primo Valenzuela, infection control physician at the Rizal Medical Center and former president of the Philippine Hospital Infection Control Society. Also joining us tonight is Ms. Ming Gomez, nurse supervisor at the Philippine General Hospital and founding president of the Philippine Hospital Infection Control Nurses Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Ming. Good evening, Dr. Prime. Welcome to MedTalk.
Good evening, Angel.
Healthcare-associated infections.
That's the current term.
That's the current term, no?
Yes.
HAI. How common is this in the Philippines? Let's start with Ming.
We cannot say na talagang very common, but actually parang this is actually parang we are trying to prevent it, but it is happening. Where we would like to target zero, but it's really happening in, I think, even in private and government hospital. Yeah.
So the target is zero.
Yes.
Where are we in the statistics, Doc Prime?
Well, it depends on which hospital or healthcare-associated infection. No? So we have ventilator-associated pneumonia, which is a sentinel disease for HAI. I think we are in the area of about 11%. No?
Okay.
11% or 11 cases per 1,000 ventilator days. No?
Okay.
And it's also a different figure when it comes to your catheter-associated UTI. We have surgical site infections also. And we have your catheter-related bloodstream infections. Okay. So different values for each of those infections.
Are patients and visitors at the hospital aware that they can get HAI when they visit a patient or when they're admitted? Ming?
Hindi naman siguro. I don't think so. Kasi that is not the primary reason why they are here. Why they are admitted in the hospital. They have other problems. And healthcare-associated infections are actually parang effect na siya ng hospitalization. No? Of everything that is being done on the patients, the procedures, the instrumentations, the interactions with the healthcare workers, and also with the hospital environment. So, we now call it healthcare-associated because hindi ito nangyayari sa hospital lang. Even in other facilities like mga lying-ins, mga centers, mga hemodialysis centers like those.
Okay, so let's not generalize na sa ospital lang nakukuha itong mga infections.
Yes, it can happen in every place that there is an interaction between the patient and a parang devices and interventions from the healthcare facility.
Wherever you render healthcare service.
Yes.
So you can get healthcare-associated infections there. But it's not supposed to be expected.
Yes.
But it has to be explained depending on the procedure that you're going to undergo in the hospital. There are some expected risks for such infections.
Okay, so it's a big health concern. No?
Yes, it is.
And we should be aware of it. That's why we're talking about
Yes.
it. That's why we want them to be informed.
Yes.
And in keeping them informed and wanting them to be, our viewers, informed, please tell us the most common types of healthcare-associated infections, Dr. Brian?
Ventilator-associated pneumonia would be the most common, no? And I think this would be followed by your catheter-associated urinary tract infections. Okay.
So pneumonia, why is it on top of the list that you just mentioned?
Okay. When you say ventilator-associated pneumonia, these are patients who are ventilated. Intubated, if you're familiar with that procedure, they have this tube, no? Either in their mouths or in their nose, and it's connected to a respirator. Okay, that procedure itself, no, the presence of that tube, no, creates a portal for entry of your organisms. No? There's a direct contact with the environment, so the organisms, whatever microbes which are in the environment, can easily go inside your lungs and cause the infection.
So,
How do we avoid this, Ming?
actually, that is the task of the Infection Control Committee or Infection Control Unit or any organizations that are concerned about the prevention of healthcare-associated infections. There are many ways now we can do to prevent this. Simple hand hygiene will do the magic, for example. But then nowadays, really, the awareness about hand hygiene is, the campaign is there. WHO, our Department of Health, everybody is talking about hand hygiene. And it's very important, really, and a simple way of preventing the transmission of healthcare-associated infection.
Okay, since we're talking about hand hygiene already, I noticed, Ming, that you're holding
Yes, I have something
alcohol
here from my bag.
So since yun na yung pinag-uusapan natin, let's
That's
talk about hand hygiene. What is the proper hand hygiene? Kasi we think when we
Okay.
wash our hands or we apply alcohol,
Alright.
that's it na.
There are two ways. You either do your hand washing with soap and water, okay, which is maybe it's the more available one. But what's more convenient is doing hand hygiene with alcohol-based hand rub,
Okay.
like what Miss Ming is holding right now.
All right.
And when you're
Simple
going to
alcohol.
use your alcohol hand rub, it has to be 70%, at least 70% alcohol, either ethyl or isopropyl.
70%.
Sige. So, do you want me to demonstrate
Oh,
the
sure,
correct
yes,
technique?
please.
Yeah,
I mean,
okay.
it's such a simple...
So you need about 3 to 5 mLs, no,
Okay.
of the rub. So
I'll
first,
do it for also.
Okay, let me have some of that too.
all right.
Okay,
So we can do it together, right?
All right.
Okay.
Okay.
So first, it's palm to palm,
okay.
and then palm to dorsum of the hand.
So here.
Okay, and then the other side also.
Okay.
All right. And then palm to palm again, but this time it's interlaced. Your fingers are interlaced.
Okay.
All right. So you're going to cover
Clean.
all the sides of your fingers, right? And then the thumb,
The thumb is
with the rotational rubbing of the thumb.
Okay.
Okay. And then do it on the other side also.
All right.
All right. Now you're going to target the back of your fingers.
So, you do that.
Okay. So
Okay.
is this the length of time that you used to use the alcohol on your
Yes.
hands with the technique that you just demonstrated, is it the same time, like 60 seconds when you
Yes.
wash your hands, you sing
Well,
a happy birthday or maybe
no.
London
That's right.
Bridge so you remember?
You're
Yeah.
going to save some time with alcoholic hand rub.
Usually it's shorter.
It's
Shorter.
shorter.
But
Yeah.
this is the end when
Yes.
you do this.
This is actually the end, and then there's another step,
Step.
which is the
The
tip of the
tip.
fingers.
You do that.
You're
Okay.
going to rub the tip of the fingers against your
You have
palm.
to do that like
Okay.
that.
Alright.
So
Is this taught
everybody-
in school?
nowadays, yes.
Some
Na-
schools,
You
yes.
can see this in any, di ba, school, the technique itself.
Yes, there are techniques.
You'll be
They're
surprised in
posted.
some malls,
Yes,
no?
yes,
It's
I've
displayed.
seen.
It's displayed in their
Yes.
restrooms.
Public bathroom, public comfort rooms, they're all displayed there.
So just doing this simple technique, hand technique,
Yes.
Can help prevent the transmission.
It's probably the most effective way of preventing your healthcare-associated infections.
And the cheapest.
and the cheapest.
Yes.
So talagang you should always have your
So
alcohol.
just to make it this
in
a
your
habit,
bag.
make this habit to do. From the kids, you do this, everybody, very easy.
Okay, since it's very easy, I know that we still have a lot to talk about, healthcare-associated infections. We'll talk more about that when MedTalk returns. Hi, Triet. According to the World Health Organization, roughly 30% of patients in intensive care units, or ICU, have acquired at least one health-associated infection in high-income countries. We're back here on MedTalk, still talking about healthcare-associated infections. All right, so before the break, you demonstrated how to clean our hands using alcohol. 15 seconds,
10
the
to
technique,
15
10 to
seconds.
15 seconds. Prior to that, we talked about pneumonia
Yes.
and how healthcare-associated infections are brought about by pneumonia. The two
Ventilators.
the
The
ventilators.
Ventilator-associated
Ventilators.
pneumonia, which is one of the more common
Okay.
healthcare-associated infections.
Another common healthcare-associated infection, I understand, is UTI.
Yes.
How does one
Yes,
get a bacteria or an infection? Once you already have that, the UTI.
Yes, that's another common healthcare-related infections, and that happens because another instrumentation is needed there, and that is the insertion of Foley catheter
Catheter.
sometimes. And not only Foley catheters, sometimes just the ordinary catheter, the straight catheter. And that happens because, in the process of inserting the Foley catheter, there's so much trauma in the mucous lining, and also the technique is very, very important. If the technique is not proper, aseptic technique, we used to say that, and then the organism is outside or in the environment of the patient can enter again the urinary tract, and that will be another problem for the patient.
See, as a patient, you trust your nurse or the doctor that, of course, you entrust your life to them when they insert the catheter
Yes.
We
or
would
the
like to think about,
ventilator. So it's a trail, Can
Yes.
we trace it?
Well, it's
Saan
like-
nanggagaling?
It's like this. It's the same mechanism as the tube in the ventilator-associated pneumonia. So you have the Foley catheter that is inserted. The procedure itself should be very clean. There should be antisepsis. But then that's not the only factor. If the catheter stays there for a long time, the higher the risk of getting an infection. So even if the procedure itself was very clean, but it stays there for a long time, then you can develop catheter-associated urinary tract infection.
How long should a catheter be inside
Depends on the indication. It really depends on why it was inserted to begin with. Short-term catheterization usually for surgical patients. They insert it, do the surgery. After the surgery, they remove it. Now, sometimes something goes wrong. Like when, for example, they forget to remove it.
Yes.
Okay? So we have to be strict with that. So it will be a responsibility of the nurses, of the doctors, who will have to order the removal of the Foley catheter.
How about the means of the means by which the infection is transmitted, like droplets from the air,
Yes.
maybe some other infection that maybe a visitor
Yes.
brought in
Yeah.
when they visited the patient, any other kind of transmission?
Yeah, there are ways by which they can be transmitted from one person to the other. Like you said, the air,
Yes.
like tuberculosis, you can get it through the air. Like most of the viral infections, the viruses, like measles, chickenpox, you can get it through the air. There are others that you can get through droplet, like coughing, sneezing, like that. Like meningococcemia, you can get it that way. Also tuberculosis. There are things that they can get through contact, like if you have wounds like that, and my hands are very dirty, and I touch your wound, and then I can give it that way. Needle stick. For example, there are bloodborne pathogens that you can get through needles. So the healthcare workers, can get hepatitis B, HIV also from the patients who are diagnosed to have HIV and hepatitis B, and other vectors. Like rats, you can get, for example, leptospirosis. Like dogs, you can get rabies. So there are many ways of transmitting really. Infections from pathogens from one patient to the others.
Those are the different modalities. But when you're talking about healthcare-associated infections,
Yes.
it's mostly contact.
Okay.
That's why we're very strict with hand
Contact
washing or
Okay.
hand hygiene.
So mostly contact talaga.
Yes.
Other than that, and what is the...
It's either direct contact, meaning you touch the patient and then
Directly.
your hands become contaminated, and then you're going to attend to other patients. There can be cross-infection. The infection of this first patient can be transferred to your second patient. Or it can be indirect, okay? Meaning the patient touched the bed railings, all right? And then the nurse or the doctor touched the bed railing, okay, and then transfer it to the next patient.
If they do not wash their hands.
So it's really a responsibility to keep your hands clean. Kasi
Yes.
as simple
Always.
as that.
It's
Simple
very
as that.
simple. It's very simple. It's very cost-effective. It's very practical.
Who's more prone or who is more susceptible in getting these healthcare-acquired infections? Ming?
Usually, the very old and the very young, or those who are immunocompromised, those who are on chemotherapy, for example, those who are in steroids, those with underlying diseases like diabetes mellitus, like cancer, like those taking steroids, they are more prone to healthcare-associated infections.
Okay, so either for example, the newborn or
In the nursery.
The elderly.
the elderly,
Yes.
the seniors, yes. For example, they're admitted in the hospital for another
Reason.
illness or another reason, and they go home, and then they contract an infection.
Infection.
Is it? How do you trace that? Do you call the doctor again? Do you trace it from who? How does that go?
Well, when it comes to healthcare-associated infections, we usually use the cutoff of 48 hours.
Okay. All right.
Because sometimes the infection might be brewing from the community, comes to the hospital,
Yes,
and then
that's
develops
true.
the symptoms. No? But then the usual cutoff is 48 hours. It should the symptoms should manifest after 48 hours.
Okay.
But then the patient may be well when the patient goes home, but then at home he or she develops infections, maybe even weeks or months after.
Okay.
So that can still be a possible nosocomial or healthcare-associated infection.
Maybe a successful surgery upon going home, no? Leaving the hospital, you're well, you're healthy,
After a few
surgery is
days.
okay. After a few days, you start to develop a cough or there's an infection in where the surgery was performed.
So it's very important that they visit again their doctors or in the hospital, so that they will be treated accordingly.
Right away. Oh.
Yeah.
What are the risk factors involved when one has
I
an
think
infection?
Ms. Gomez has already mentioned some, no? Presence of an underlying disease,
Yes.
maybe uncontrolled diabetes, malnutrition, no? As simple as malnutrition can make you immunocompromised. That's how we call these patients with low immune system. All right, so immunocompromising states. Patients who are taking your steroids, patients who are post-transplantation, because they're
Organ
taking a
transplant.
lot of medications.
Medications.
I think ordinary hygiene and
Yes.
Hygiene talaga. It all boils down to
Yes.
hygiene and
Hygiene.
sanitation. No?
because some derma, the boils, those can be, significant organism like Staph aureus, and those from the community already. Yeah, and when it is in the hospital, those are very significant, especially if they are the resistant type of organism. Yeah, like MRSA.
MRA.
Yeah, there sometimes are misconceptions in the hospital that when you get confined, you're not allowed to take a bath. But
Yeah.
actually, you should be taking a bath.
Okay.
Okay. There are only very, very few exceptions to that.
What are those exceptions?
Like, for
Prime.
example, you have a very extensive surgical procedure that it's impossible really to take a bath. But for most cases,
hygiene.
taking a bath while confined is encouraged.
Okay, so that's the we've spoken about or talked about the responsibility of the nurse, the doctor, a healthcare
really
worker, to educate, to
health
keep
education
your
is very
hands
important.
clean, down to the security guards of the
Yes.
hospital. How about the responsibility of a visitor? You visit your family member or a friend,
your
mom,
tita.
your tita,
Yeah,
your
yes.
friend who has just given birth. What is
Okay.
your responsibility as a visitor? Because you can be the carrier of that
Exactly.
virus.
Yeah, that's true. That's true.
If
Very
you think
true.
you're sick, if you feel sick, if you have colds, if you have cough, okay, you might as
Avoid.
well not visit your relative because
Yeah.
you might be the one transmitting the infection. All right. Now, if you're not, if you feel healthy, naman, no, if you're going to touch or kiss or whatever is it that you do,
Filipinos are
yeah,
very caring when they go to the
yes,
hospital.
that's
They want
right.
to hug you, they want to kiss you,
They like
wanna
to visit
touch
you all the time, no?
Yes, even
So-
after visiting hours, they're still
That's
there.
right. No. What you can do is you wear your mask, no, to protect the patient from you, and you wash your hands.
Okay.
Yeah.
Wearing a mask, sometimes, no, when we see someone wearing a mask, we get scared or we become sensitive because someone is wanting us to wear a mask.
Yes, yes.
Maybe, how do you educate us on being okay with wearing a mask or giving a mask to someone whom you see is coughing?
Yeah. Well, there are cultural considerations, no. Some factors are really have to be considered, but then we have this thing called cough etiquette, okay, wherein you have to cover your cough, you have to cover your sneeze, you have to bring your hanky all the time, or you should have your tissue all the time to cover your cough or sneeze, you know. So actually, it's being taught, no, in schools. It's being taught at a very young age, and well, it's a culture that we have to develop as a nation. Because if you're going to other countries, for example, Hong Kong or Japan, many people in the train stations, even just walking on the street, those in the public, crowded public places, they wear their masks. No? And that's either because they're sick and they want to protect others, or somebody's
to be
sick and they want to protect
Correct
themselves.
themselves. Okay, so no reason na para, sometimes nakaka-offend, di ba?
Yes.
If you say, you're coughing, here's a mask.
Yeah.
Yes.
Or we should, maybe all of us should have a mask in our bag.
In the hospital, we do that. No,
Okay.
we offer the mask if we think somebody has symptoms of respiratory infection.
Yeah, just the ordinary
The
surgical
ordinary
mask.
surgical mask is okay.
Other, yes, Ming, you're about to add
Yeah,
something.
we're talking about cough etiquette, and
Yes.
really we can see people spitting all around, and that's
Also.
really, we have to change that culture.
We have-
That practice, we have to really change that.
So how has it been? I mean, changing that culture, changing that practice, in your observation, your practice, doctor, how has it been?
Well, we start in the hospital, and then we educate not only the patients, but also the visitors. And we also have community outreach programs, and we teach all of these practical infection control, infection prevention measures. You know. And maybe with the help of social media, with the help of mass
Yes,
media,
Yes.
we can spread the word and try to change the culture.
We are also very happy now that even the academe, the schools, they really are sharing this responsibility, educating our children on how to wash their hands,
Yes.
how they carry this, the hand kiss, they clean themselves, I think it's also even in the curriculum, in the nursing curriculum, in a medical school, they also teach this infection control already.
Okay, so infection control, teaching infection control to everyone, not just the kids, but
From
up
kids
to the elderly,
Trainees,
seniors,
yes,
the
everybody.
seniors, everybody, whether you're in the hospital, outside of the hospital, you must practice good hygiene. And we'll talk more about that. We'll also talk more about preventive measures.
Okay.
All that and more when MedTalk returns. We're back here on MedTalk, still talking about healthcare-associated infections. You may join our discussion by calling our hotline at 548-4678. This time, let's talk about, still talking about the common healthcare-associated infections. You mentioned earlier wound infections.
Yes.
When someone has an open wound and...
Yung simple surgical site infection, for example, as he said before, if your hands are dirty and you touch that one, whether you're in the hospital or in your house, that could result to healthcare-associated infections. So you can see discharge there. There will be some sort of inflammation, and those are not good signs. No.
Do you have to get tests for that, or a testing? A test to check the kind of infection that one has.
If it's severe, you might have to do culture and sensitivity on that sample.
Okay.
So that you will be given appropriate antibiotics.
How about superbugs?
Yeah.
Those that are resistant to antibiotics. You mentioned
Yes.
antibiotics. The superbugs are resistant to antibiotics. How
Yes.
do we remedy this concern, Doc Prime?
Well, there should be judicious use of antibiotics. Much of the reason why there are multi-drug resistant organisms right now is that we use antibiotics left and right. No?
Okay.
Even before the patient goes to the doctor, he or she has taken 1 or 2 antibiotics already.
On her own.
On her own. No? So this can lead
Without prescription.
to higher resistance rates. Okay? And when we talk about healthcare-associated infections, we do expect drug-resistant organisms to be the infectious agents. That's why when we say healthcare-associated infections, we expect that these infections are harder to treat, actually, compared to a community-acquired infection.
Okay. So, harder to treat, it shouldn't be there in the first place.
Yes.
You shouldn't have to treat it in the first place.
That's right.
Isn't
So
that right?
we would like to prevent it.
Okay.
So that's why we do infection control. Yeah.
Mig and Doc Prime, we have a Facebook question. Are there available vaccines for some hospital-associated infections?
Unfortunately not. We don't have specific vaccines to prevent hospital-acquired infections.
And how do you administer the vaccine prior to going to the hospital?
We do have vaccines, but these vaccines were designed for community-acquired rather than healthcare-associated infections. But there are measures that we can make use of, like you keep yourself healthy, you eat well, make yourself well-nourished, you exercise.
Okay.
So all of these strategies will keep you healthy and make your immune system stronger.
We want our immune system to be stronger in the event that we do go to a hospital or a lie-in clinic, and so that we don't get healthcare-associated infection. But in the event that our immune system is down and we go and we are infected, what are the first few steps, or what's the first step that we should do?
Okay. Well, in a hospital setting, we are going to isolate you. Okay?
Okay.
We're going to do some isolation precautions, okay? And then treat you accordingly, depending on what infection is it that you have.
Sometimes, yes,
Yeah.
Ming. Go ahead.
So really, if we have infection control program in the hospital, these are the things that we do. We would like to protect our patients because we are providing the right environment, meaning to say, and also the devices that we use are properly sterilized. So even if there are no vaccines, we can protect also our patients by providing the environment that will not allow transmission of this microorganism. So we would like to make sure that this is in place in any healthcare setting. Yeah.
So you're already isolated. There are other healthcare measures that are taken. How about visitors? We've mentioned it earlier. How do you, for the lack of a better term, control visitors?
Restriction.
Yeah, actually,
Restrictions.
we do have to restrict visitors. We do have to restrict visitors. And each hospital have their own policies on visitor restrictions. As a general rule, we discourage children from visiting the hospital or visiting their relatives. Okay.
And I think it's very important that we explain that to the relatives or to the patients or to the watchers, and because they might be hurt.
Yes.
They will complain.
Yes, they will
Patients are
complain.
Very sensitive.
Yes.
Very sensitive.
They will complain.
And we don't want them to complain. We don't want them to get sick. We don't want the patient.
Yes.
We don't want them to feel stigmatized or isolated.
So I think it's a matter of communicating it correctly.
Saying
to
it
the
properly.
patients.
It's always the manner by which you say things.
Exactly.
you know.
It's in the delivery.
Exactly. Doctors, we have Dr. Prime and Ming. We have a Twitter question. Are hospital-associated infections more common in different parts of the hospital? You have your ER, the ICU.
Yes.
It's
ICU.
usually the critical care units, the ICUs, the adult ICU, neonatal ICU, pediatric ICUs, because these patients are more prone to developing infections.
What type of infections are most common in the neonatal, the ICU, and the emergency?
It's the same
Yeah.
HAIs, no? Ventilator-associated pneumonia, catheter-associated UTIs, bloodstream infections.
Whenever there are devices that are being used for the patients, whenever there are instrumentation and intervention, the patients are more prone to healthcare-associated infections. Yeah.
You want to be you're confined in the hospital because you want to get well.
That's right.
You don't want to stay longer.
That's
or
right.
go home and then come back.
That's right.
Yes.
Ming, Doc Prime, we have a Facebook question. Is the Ebola virus a hospital-associated disease? How do you get it? Doc Prime.
Mainly, it's a community-acquired infection. But, like what's happening in other countries right now,
Yes.
once that patient, we will call that patient the index case. Once that patient is confined in the hospital and other patients contract disease, or even the healthcare worker, if the healthcare worker becomes sick also with Ebola, then technically it's a healthcare-associated infection. It becomes a healthcare-associated infection because you acquired it in the healthcare facility.
Yes, you did not acquire it
In the community.
in a community.
In a community.
Because now in the news, it's associated already with the hospital.
That's right. No. But mainly, the main modality of transmission is still in the community.
Okay.
From the community.
Gloves and surgical masks. We've spoken about alcohol. Any other precautionary measure that one must take in order to prevent these infections from happening? Ming?
We call them those gloves. We call them personal protective equipment. Gloves, masks, goggles, gowns. We call that personal protective equipment.
Okay.
But then they might be available, but the technique and the proper use of those PPEs is very, very important. Because if you will not use them properly, you are still prone to getting the disease. So we are teaching them also on how to properly use those personal protective equipment.
Is it more prevalent now, the healthcare-associated infections?
I think it's less.
Okay.
Actually,
All right.
the rate may actually be decreasing, but it's like this. It's only in the more recent years that we've been very conscious about doing surveillance.
Okay.
That's why the rates may be going up, but then that's because we are doing more surveillance now.
Okay.
So that we know when to become alarmed if the rate is going up. Each hospital is doing surveillance on its own.
Whether it be a private or a government
Yes.
hospital. Is there a unit or an organization that monitors, that does the surveillance, Dr. Prime?
Well, mainly it's the Department of Health.
Okay.
And they get these rates, no, for licensing purposes. I think the bench book of the PhilHealth also looks at the infection control program of the hospital. And we do have professional societies, no, which are advocates of infection control.
Okay.
Okay, and I think basically those are the agencies involved.
Schools and offices.
No.
Is there like a program, or is there like guidelines to follow?
There are guidelines, but in terms of monitoring them, I don't
Yes.
think it's being handled by DOH. But
Okay.
usually in the local government units, there are public health units who also take care or look at how the schools and other institutions are doing.
Okay. Doc Prime, Ming, we have a Facebook question again. How soon can I mingle with other people after being discharged from the hospital? Okay. Depends, I guess,
It
on your
depends,
illness.
yeah. It's actually a very common question among patients.
Okay.
Maybe the doctors forgot to inform them of when they can mingle. But really, it depends on the reason why you were hospitalized. If you were hospitalized because you had, for example, a heart attack, and you recover and you get discharged, then you can actually mingle with other people right away.
Okay.
There's no risk. But if you got confined because of an infectious disease, okay, and you are recovering, but you still have the potential to transmit the disease, then the doctor should tell you as to when you can start working or mingling with other people.
Okay. How about once you've given birth? A lot of people are excited. They want to see you. They want to congratulate you and the baby. How careful
Everybody's
should we be?
Well, if you can't help it, just ask your visitors to wear their masks.
Okay.
And wash
do
their
hand
hands.
hygiene.
Okay, so
Just offer the alcohol.
okay, kasi diba, Filipinos, you're always so
Oh, yeah.
excited
Care
when
for
there's a
our
baby.
That's
relatives who are
Whether you came from the hospital or you're still in the hospital, they will come and see you.
Yes, yes.
sometimes
Which is not
you-
necessarily a bad thing, right?
No, we want them there. We want them to celebrate with us, but we
That's
do
right.
not want anyone
we
who
have
has
to explain to
visited.
them that you have to rest also, you have to recover.
Most especially when the baby is
Yeah.
inside the room.
Yeah.
Yeah,
Diba?
and there are so many practices also, like touching the wound of the patients like that.
Oh, what's happening to that?
Or can I see you?
Everybody's so excited.
Yes.
That's true.
Contain the excitement and we
And,
contain the infection.
Yes.
All right. We'll talk more about healthcare-associated infections when MedTalk returns. Did you know that smoking can lead to a weaker immune system and therefore make you more prone to getting hospital-associated infections? Smoking wrecks the airways, in which in turn increases your risk of getting lung infections. We're back here on MedTalk, still talking about healthcare-associated infections. Ming, Doc Prime,
Yeah.
October 15 is World Hand Washing Day.
Yes.
That's tomorrow, on
Yes, that's
Wednesday.
tomorrow.
It's around the
What-
corner.
Yes,
Yeah.
what's the campaign about? May
Yeah,
please
it's
tell us?
actually a campaign really to increase the awareness on the importance of hand hygiene, and I think it's it's very important that everybody will do it, because
Okay.
if we do that, 80% of our problems is already solved. So the hospitals, the facilities, they celebrate this occasion to really inform everybody, not just to it, and we don't have any problem.
Okay, so nauna na tayo here.
Yes.
Doc Prime, you wanted to add
So
something?
this is the social media and
Yes.
a venue for this campaign, for this information. Yeah.
Well, sometimes people think that hand washing, control of infections is just the business of a hospital, no?
Yes.
But it should be actually a business of the community. So for World Hand Washing Day, we want to celebrate it not only in the hospitals, but even in schools, and other institutions.
What happens during World Hand Washing Day, the whole day?
Um,
Aside, you've
well, it's a
mentioned,
campaign.
no? It's a campaign,
It's a
so
campaign.
talagang the whole day reminder of
Yeah.
just
Sometimes may
clean,
mga,
washing.
like in our institution, we have a parang with the kids, we make them parang, they do the technique, no? They demonstrate to them the technique, how to do it. And sometimes we also would like to tap champions, the key people who will, when they do it, it will follow everybody will do it also in the healthcare facility, like the directors of the hospital, the administrators, because they have also to provide the facility in doing the hand hygiene, like soap and water, like alcohol, like that, the clean towels. Those are needed so that we can practice also proper hand hygiene. So this is a time that everybody will join forces na maging effective talaga yung hand hygiene campaign. No?
And it should be a fun activity, no?
Yeah.
It shouldn't be a chore.
Yeah.
Off cam, we were saying it should be second nature to practice proper hand hygiene.
That's right.
And in practicing proper hand hygiene, we go back to practices in the OR or in the ER that if not done properly might lead to infections. A personal story, my grandma had a knee operation, and shortly after the operation, she was sent home.
She was
And
fine.
She was fine. She was fine. After a while, she had an infection in her knee, and we had to go back to the hospital. So that is a healthcare-associated infection that could have been prevented.
Yeah.
And it can be it's very expensive.
It's one of those things that we should be watching out for. Okay, mga surgical, we call them the surgical site infections. But there are strategies to prevent that, no? So proper sterilization of the surgical instruments that they use, proper cleaning of the operating room, proper technique
of the surgeons.
The longer the surgery
Duration.
lasts, the higher the risk of developing an infection. Okay. And maybe even the antibiotic prophylaxis that was given.
Okay.
So those are the things that we can control. Okay. But then, of course, there are other factors, like, for example, the age of the patient.
Yes.
No? So that probably could have been a factor when she developed the infection.
So,
Other diseases, underlying diseases. No? So infection control also, we would like to provide the right environment, especially also in the operating room. He said, the proper sterilization of the instruments, and also the proper disinfection of the operating theater also.
Yeah. So you see, it's not just the job of or the business of the nurses and the doctors.
or the individuals lang,
Yes, we involve it's a multidisciplinary endeavor. We involve the engineers, okay? We involve the medical technologists, the laboratory, okay? The administration, even HR, okay? And then, of course, the nurses, the doctors, the housekeepers are very important. Even the security guards are important. We have to educate them also because they actually are the first contact.
Yes.
That's right.
When the patient comes to the hospital.
And there is another trend now na the patients can be empowered also that they remind the healthcare workers, simple thing. Doc, did you wash your hands
So it's-
before touching
We
me?
encourage it.
It's okay.
Yes.
To
okay.
remind our
Healthcare
doctors.
workers.
Yes.
Doctor, I noticed you have a cough, or do you
Can
wash
you
your
please
hands?
wear
Can
your
you please
mask?
wear your
Yeah.
That's okay.
Yes.
Yeah.
All right. Twitter question. How
Patients'
effective
rights.
are the hand sanitizers you buy in stores? We just, okay.
yeah.
This is hand
There are
sanitizer.
so many brands available, right? But the minimum requirement is that it should be 70% alcohol. If you're getting the alcohol-based hand rubs, just look at the label or something and just look for the 70% concentration, and you'll be fine.
Okay.
Because there are those that 40% yung rubbing alcohol na used for as to massage.
Okay.
So those are not as effective as 70%.
Okay. Ethyl, isopropyl.
It's okay.
Either
Either
will work.
Okay.
The recommendation of the WHO actually is from 60 to 90%. So the commercially available 70% is just right.
Okay. Okay. And then these are readily available in your
Yes.
grocery or your
Yes.
the convenience stores
Yes.
that are open 24 hours.
That's right.
Yes.
Should be there.
Some are in gel form.
Okay, gel form is
yes,
also
there are
okay.
some. But just so it will not cause drying of the hands, they say, but could be sticky also.
Okay. Basta you get your hands clean.
Yes,
That's
right.
enough.
You get your hands clean, and you know na it's a responsibility. It's
Yes.
your
Yeah.
responsibility to have clean hands.
That's
Very simple. We're taught as kids.
That's
I have
right.
two hands. Clean your hand, left and the right. You know,
Good manners and
good
like
manners.
conduct.
Exactly.
Where is that anymore?
Good
Where's
manners
that
should always be
nowadays?
practiced. Yes. And in practicing good manners, right conduct.
Yeah.
If the healthcare facility is found to be negligent of these practices, these hygienic practices, are there penalties involved?
I think the Department of Health requires a good infection control program in all hospitals, and I think they use it for licensing purposes.
Okay.
I don't recall a particular hospital that has been suspended, but they do give warnings,
Okay.
and they give the chance to the hospital for them to correct themselves.
Yes. Part of licensing.
All right. And that's part of licensing for the healthcare facilities. Again, let's
And
remind...
reimbursement of PhilHealth.
Sorry?
Reimbursement of PhilHealth.
Oh, the PhilHealth. Okay. All right. Reminding our practitioners, medical practitioners, the visitors and the patients, again, simple reminders for us, for them to think about when they visit the patient or when they themselves are the patients in the hospital.
Okay. Well, healthcare-associated infections are actually a fact of life, but it's something that we can prevent. Okay, so it's a shared responsibility between doctors, nurses, the hospital administration, even the patients and their visitors. Okay, so if you're visiting a relative or a friend, make sure that you're not brewing a certain infection. Make sure that you are healthy, and just practice your hand hygiene. And if you're not feeling well, then maybe you can wear your mask before going to visit, or don't even go if you're not feeling healthy. And for doctors and nurses, again, the very simple hand washing procedure is one of maybe the most important and a very effective, very practical way of preventing healthcare-associated infections. If you have a good hand hygiene compliance in your hospital, it actually reflects the overall infection control program of the hospital. That means that you're doing everything else correctly.
Okay, thank you, Doc Prime. Ming?
So, infection control, we would like to say that is a part of a changing culture of safety in the hospital, in the community, in the homes. And it is, I think, our task to really promote it, to be an advocates of infection control. We've been doing this in the Philippines for so many years already, and very happy now that I think it's becoming everybody's concern. It's become, the change is there already. We can see it. Now everybody's concerned about preventing healthcare-associated infection as a complication of hospitalization or any activity interventions that's being done on the patients. So we are very happy about that. Our mentor said that infection control should be a way of life.
Okay. So infection control should be a way of
Yes,
life.
yeah.
Thank you for helping us, educating us, have that habit
Yes.
of practicing good hygiene.
That's right.
And I hope all our viewers remember the simple steps in cleaning our hands. We can apply that to washing our hands as well.
Yes.
Apply same thing. Thank you very much,
Thank
Ming.
you very
Thank you,
much.
Doc Prime.
Thank you for having us, Angel.
Thank you. And to those who sent in their questions via Facebook and Twitter, maraming salamat sa inyo. See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night.
I think we are in the area of about 11%.
Okay.
11% or 11 cases per 1,000 ventilator days. No?
Okay.
And it's also a different figure when it comes to your catheter-associated UTI. We have surgical site infections also. And we have your catheter-related bloodstream infections. Okay? So different values for each of those infections.
Are patients and visitors at the hospital aware that they can get HAI when they visit a patient or when they're admitted? Ming?
Hindi naman siguro. I don't think so. Kasi that is not the primary reason why they are here. Why they are admitted in the hospital. They have other problems. And healthcare-associated infections are actually parang effect na siya ng hospitalization.
Okay.
No, of everything that is being done on the patients, the procedures, the instrumentations, the interactions with the health.
Patients in a healthcare facility and even hospital personnel can acquire these nosocomial or hospital infections, with most affecting the urinary tract, bloodstream, lungs, and wounds.
Healthcare-associated infections are actually infections that the patient will get by getting or receiving health care from hospitals, yung chronic care facilities like dialysis units. So anyone who's receiving health care who will get infection due to that, that's called healthcare-associated infections.
According to the World Health Organization, at any moment, roughly 1 in every 20 inpatients has an infection related to hospital care. In the Philippines, 500,000 patients get hospitalized associated infections yearly, with about 10% of the cases considered fatal. This type of infection may manifest after a couple of days of visiting a hospital. Although at the Philippine General Hospital and founding president of the Philippine Hospital Infection Control Nurses Association. You may join the discussion by calling our hotline at 548-4678. Good evening, Ming. Good evening, Dr. Prime. Welcome to MedTalk.
Good evening, Angel.
Evening.
Healthcare-associated infections.
That's the current term.
That's the current term, no?
Yes.
HAI. How common is this in the Philippines? Let's start with Ming.
We cannot say na talagang very common. But actually, parang this is actually parang we are trying to prevent it, but it is happening. Where we would like to target zero, pero it's really happening I think even in private and government hospital. Yeah.
So the target is zero.
Yes.
Where are we in the statistics? Doc Prime?
Well, it depends on which hospital or healthcare-associated infection. No? So we have ventilator-associated pneumonia, which is a sentinel disease for HAI.
newborn babies, the elderly, and those with weak immune systems and medical conditions may have increased risks.
Generally, it would be something that the patient will get after 48 hours of admission as a result of either treatment, diagnostic, or management.
The important thing is that you know what to do prior to and after your visit to the hospital, since this will greatly decrease your chances of you getting an infection. What are the most common hospital-associated infections? What are my chances of getting an infection in the hospital? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Primo Valenzuela, infection control physician at the Rizal Medical Center and former president of the Philippine Hospital Infection Control Society. Also joining us tonight is Ms. Ming Gomez, nurse supervisor. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Hospitals are designed to house the sick and the injured, but in some cases, they can also be the source of healthcare-associated infection.